Okay, welcome back. And that was Janet on phone etiquette. Now let's talk about health as it concerns Orthopaedic Foundation of Nigeria, and that's Foundation of Orthopedics and Complex Spine. Sorry about that. That's Focos, and it was established as a non-for-profit organization to provide comprehensive orthopedic care to undeserved population throughout Africa, and particularly in Ghana. Underserved, yes. Sorry, yes, underserved population. So is Nigeria in focus now? These and other questions about the organization will be answered by the Focos founder, Professor Oheneba Boachi Adje. He's joining us from our Abuja studios. Good morning.
Good morning, and thanks for having me on your program.
Good to have you. Now, tell us more about Focos.
Yeah, Focos stands for the Foundation of Orthopedics and Complex Spine, and it was established in the United States in 1998, where I had private practice at the Cornell Medical Center and also the Hospital for Special Surgery. I'm a native of Ghana, and I've been in the United States for 40 years. My primary goal going to the United States was to study, become a specialist, and to come back and provide the same specialty care to Ghanaians, Africans, and those around the world. So in 1998, this foundation was established as a non-profit organization, and then since then, I was bringing volunteer groups with me to Ghana to perform spine surgeries and joint arthroplasties. So over the years, spanning about 15, about 500 volunteers accompanied me to Ghana, and they came from all over the world. So throughout that process, we were able to get sponsorship from companies to provide us with equipment and supplies, money to sponsor patients who needed orthopedic treatment, and also to be able to build a clinic where we're able to house our facilities and also to have a staff that will coordinate the process. And then in 2012, having been able to raise about $20 million to build a hospital, the Focos Orthopedic Hospital was opened in April of 2012, and that's where we have been to today. I myself, as an orthopedic surgeon in the United States for 25 years, retired in 2014 to come back to Ghana to run the hospital and to help develop it into the future.
Do you have any hospital in Nigeria at the moment?
No, we do not have a hospital in Nigeria. However, we collaborate with Nigerian physicians. We have recently established the West African Spine and Scoliosis Society. I have been here several times to give lectures and hold seminars. So our goal is not just to provide the care to Ghanaians, but also to non-Ghanaians, people in West Africa, and we have had patients from Sierra Leone, Nigeria, as far as Ethiopia, and even beyond. So we do not have a physical structure here in Nigeria, but hopefully Nigerian physicians and the government will see it fit to eventually establish something of this nature here.
Okay, so tell us, in your activities over the years, what sort of orthopedic challenges do you find in people?
Yes, so orthopedic conditions are the second cause of disability throughout the world. So we're not immune to that. And unfortunately, when it comes to underserved regions, like in our sub-region, patients or people with orthopedic conditions come to us very late. The deformities are basically untreated, so they're very severe and will meet a significant challenge to any orthopedic surgeon, even in the first world. So we have conditions such as arthritis of the hips and knees that will require joint replacement in older individuals. There is spinal deformities like scoliosis and kyphosis. Some are congenital, some are idiopathic, and that is genetic. and some are also caused by infections like tuberculosis. So you see hunchbacks that are going around, and those patients will have a short lifespan because eventually their lungs and chest become congested, and all they need is one bout of pneumonia and they will be dead. So there's a significant effect on lifespan in these patients with spinal deformities. So orthopedics, which is musculoskeletal conditions of the nerves, bones, joints, and the muscles, all over the world, and we're not immune to it. So we need to address them. And it requires expertise to be able to do that.
Okay, you've mentioned arthritis, and I know that most of the time they talk about it in terms of, okay, a person is going to come down with arthritis because of old age and, just aging. But we find arthritis in younger people. What is accounting for this?
So arthritis can be of several causes. As you said, the most common cause is degenerative, that is in old age. But there's also immunological conditions like rheumatoid arthritis that can affect anyone at any age. So we have juvenile rheumatoid arthritis. Then also we have sickle cell disease. Sickle cell can also destroy joints. And that's probably what we see most commonly in the younger patients with arthritis of the hips and knees that are being destroyed by sickle cell disease. So the immunological, the degenerative, and then also infections. Since infections are more common in our environment, infectious conditions can also destroy joints and leave children crippled because it has affected or destroyed their hips or their knee joints.
Okay. And now, let's look at, you look at